Hello and welcome to Facebook Live with Dr. Bri and
Dr. Bri.
Today we are talking about what is a traditional osteopath. So, Dr. Bri Seefelt and
Dr. Brianna Anthony.
We have just started working together as of last Friday.
Yeah.
I know, so exciting. I wanted to do this special interview because you have the unique opportunity to tell us about why you left family medicine to do an osteopathic only practice up in Fort Collins. And we're lucky enough to have you here while you're building your practice to have special cameos here and there doing traditional osteopathic treatment for our members. So I wanted to go through a little bit about what that looks like because I do have some members in our practice here because we do direct primary care that don't even know that I do treatments and find out years later and then say, like a patient of ours you saw today said, can that treatment thing that you do help me with this problem? And I'm like, of course.
Yeah.
So I wanted to let everybody know a little bit about what first it looks like to just be a D.O., a Doctor of Osteopathy in the United States. And then you and I can talk a little bit more about what it means to be a traditional osteopath. Because it's a little different. Okay. Yeah. So there are two types of medical doctors in the United States, medical doctors, MDs, and doctors of osteopathy.
Yes.
We are licensed practice medicine in all 50 states.
Mm-hmm.
We have a lot of similar trainings, right? We have 4 years of medical school, and then we take board exams. We go to residency.
I actually took both the board exams.
I was telling my kids the other day how many exams I took to be a doctor. They were mind blown.
Yeah.
Then we do our residency, which is our specialty training.
Mm-hmm.
That includes typically an intern year and then our residency years. And then you're a board certified some kind of doctor specialty.
Yep. And it can be in any specialty. So you'll see like neurologists who are D.O.s. You'll see ER doctors who are D.O.s.
Yeah, you could go to the ER right now and see a D.O. and not know the difference unless you saw the name tag that said D.O.
Yes. Mm-hmm.
That's something I think that is a common misunderstanding until people start to realize what it is, and then they realize that we are trained a little differently along the way.
Yes.
But not all of us maintain that difference that makes us traditional osteopaths. So when you see an ER doctor, they're not usually able to use the traditional osteopathic skill set, our toolbox that we're talking about today, because of the setting that they're in.
Yeah.
In the ER. So along the way, as an osteopath, we learn in the first 2 years where you're doing mostly book work and classroom work and science, we learn, in addition to all the MD curriculum, this hands-on osteopathic treatment.
Yeah.
Some people call it osteopathic manipulative medicine, OMM. Some people call it osteopathic manual therapy. Rocky Vista, where we met, it calls it osteopathic principles in practice.
Yeah.
What's another name? Neuromusculoskeletal.
I was going to say, I sometimes say osteopathic manipulative treatment.
Yeah. I think this is part of our problem because chiropractors were like, chiropractor is the name. And so it's a household community name. Everybody knows what chiropractor is. And this is one of the problems in the marketing way of osteopaths. So we totally missed the boat on just picking a name, which is why I like to say traditional hands-on treatment. Because that's really what osteopathic treatment is. It's a hands-on modality that we use. So we teach this osteopathic manual therapy in the first 2 years, mostly in the classroom setting, with students learning on other medical students how to feel, how to diagnose, and how to use different treatment modalities.
Yeah.
Then when you get into your rotation years or clinical years, you sometimes see people like me who use traditional osteopathic treatment.
Yes.
How often do you think you saw a real doctor, a real osteopath use real traditional osteopathy in those last 3rd and 4th years of med school?
Unless you're doing like a very specific rotation or spending time with a doctor who does do traditional osteopathy, you really don't get that much. And so a lot of people who don't do extra training in osteopathic hands-on treatment, like traditional osteopathy, just sometimes lose that as they're going along
Exactly. That's the first place where we lose it.
Yeah.
We take students here as our, patients know, because we feel like it's important for the 3rd and 4th years to have an opportunity to be able to see real osteopathic treatment in real life, traditional osteopathy, because here we're using it not on healthy young medical students. We're using it on people with a problem, or, somebody who comes in with a complaint, and we are actually using it as a treatment tool. So I really like for the students to be able to see that. But, for example, just general ballpark numbers, right? I think there's maybe 150-ish students at Rocky Vista per class. That's the osteopathic school in Parker, in Denver area. So, and we take probably 5 students a year. Right?
Yeah.
So of that whole class, that's how many students, and sometimes we take more, but you get the idea.
Yeah.
It's a very small percentage that is exposed, and that's maybe 1 month of the whole, 3rd year.
Yeah, because you have a lot of other required courses that you have to take, right? Family medicine, psychiatry, all of the different specialties, surgery. That
was my hack, was like, if I did family medicine, I wanted it to be with somebody who did traditional osteopathy.
Yeah, because they go together.
Yeah. And so I think that's one of the places where, you and I can talk a little bit about who does traditional osteopathy these days, right? So I was trained in family medicine.
I was also trained in family medicine. Yep.
You were. But you and I had a unique and different path to get here, right? So both you and I did a undergraduate fellowship year. So while we were in medical school, we tortured ourselves by going to medical school for a whole extra year.
I know. I can't believe I did that, but I'm so glad I did.
So tell me what it was. What is an undergraduate teaching fellowship?
At Rocky Vista, where I went, it was an extra year kind of in the middle of our residency or our medical school. So I got to do those rotations that we were talking about, but I also got to teach, learn more, and work in a clinic doing osteopathy. And so I was really able to, one, fall in love with it and see the benefits of it and kind of hone my skills and my touch and being able to feel things.
I think that's really important, because the very first time I experienced traditional osteopathy, I was 18, and I took a bus from UC Berkeley all the way to San Francisco to find this amazing osteopath who's still out there, Runa Basu. I'll probably tag you. And I had a treatment myself, and I walked out and called my dad and said, that's what I want to do for the rest of my life. It was so incredible. I remember the bones of my wrist adjusting later that day, and she had never touched my wrist. So I was like, this woman is amazing. I want to know what she knows.
Yeah.
So then, of course, I tortured her by saying, can I come and learn with you? So I then did some volunteering and some observing with her as an undergraduate. And I said to her over lunch at the end of this process, I said, how do I learn what you know? And she said, you have to decide if you want to be a really good body worker or if you want to be an osteopath. Because you could be a really good body worker and not go to osteopathic medical school. And if you want to be an osteopath, because of course at that point I wanted to be exactly what she was. So I'm like, no, I want to do what you do. And she said, you've got to get your hands on people.
Yes.
And I went to massage school before I went to osteopathic school, because I wanted to get my hands on people, and I knew I was taking a little gap year. So I think that's really important, because in the first 2 years and in these kind of sparse 3rd and 4th years of the exposure, it's very hard to graduate feeling confident in your skill set that you can do everything with this toolbox that it is capable of.
Yeah, and put everything together.
Yeah. I call them the hats. I have my osteopathic hat, and then I have my allopathic hat, which is my MD hat. Like, this is my Western medicine hat, but here's my traditional osteopathic hat. And then it took me about a decade to start to merge them.
Yeah, because I was going to say the cool thing with the training we get is we can merge those.
Yeah.
We have that huge knowledge base to help our patients.
Right, because we're trained in pharmacology and all the diagnostics and all the imaging that a normal doctor learns, plus we have our hands that help us actually feel diagnoses with our hands, right?
Yep.
And then we have our toolbox, which we're getting to. So you and I both did an undergraduate teaching fellowship, so that was an extra year within the first 4 years, which for us were 5.
Yep.
Mine was in California, at Toro, California. Yours was here.
Yep.
Then you and I both went to family medicine residency.
We did, yeah.
Where we were able to maintain our skills. How were you able to maintain your skills?
In residency?
Yeah.
I would say I did like a little bit in residency. We had like once every 3 months a afternoon where we treated patients. But I did courses. And so I did extra training and extra courses to, one, keep my skills up, also like learn from others and be treated myself.
Yeah, that's a great point. I have done courses for a long time, and I just started doing them again post-COVID, and it's been so great.
Yeah.
So that's where we talk about our toolbox, right? So our toolbox is pretty big when it comes to osteopathic treatment modalities.
Right, yeah.
But let's pause on how else you could become a traditional osteopath, right? So we talked about how you and I did it. We're family medicine doctors who can also use traditional osteopathy because we trained and maintained and honed our skills.
Yes.
But we had to put in the elbow grease for that. Okay.
Yeah.
Then we have other people who have gone to, internal medicine residencies. Some people, I even know one psychiatrist who ended up just doing 100% osteopathy later.
Yeah.
So there are people in specialties who still kind of maintain the treatment techniques and get good at them.
Mm-hmm.
And then we have our traditional osteopaths who do residency in traditional osteopathy because they're super dedicated to our art. And we don't want to miss talking about their specialty track because it's really a unique experience.
Yeah. So they get very good training.
They get very good training. So instead of 3 years and 80 hours a week of family medicine-ish that you and I did, they get 3 years and 80 hours a week of hands-on treatment in a hospital setting, in an outpatient setting, in specialties, and in general practice.
Yep, and patients of all ages.
Yep, and then they become neuromusculoskeletal medicine specialists. And that's a handful. That's a whole other term, but it's great. And we have several of those here in Colorado.
Yeah.
We're really good friends with all our NMM folks. We just had a big conference in Colorado Springs at the Broadmoor with all of our osteopathic colleagues from the American Academy of Osteopathy, and we're a pretty small community.
Yes, yeah.
So it was great.
We'll get to hang out.
Yeah,
and learn.
And
treat each other.
And we learn from each other, and we learn from our lineage. So now we should talk about our toolbox. So now you know that D.O.s are doctors. We have extensive training. We have training in lots of specialties, and one of those niches is traditional osteopathy. I heard a statistic at our convocation that 20% of us maintain these traditional osteopathic skills or use them at least occasionally.
Yeah.
In clinic.
Have it in our toolbox.
Have it in our toolbox. There you go. And hopefully in the 80% of us that don't use it anymore, we still recognize it as an important tool and refer to people like us if you need it.
Yeah.
So in our toolbox, what is in your toolbox?
So I often describe that we learn a lot of anatomy and how things connect to each other, which I like to think about a lot. And so there's everything from cracking and popping that we do.
High velocity, low amplitude.
That's
it's like what you would see at a chiropractor.
Yep. To sometimes working with the muscles, the fascia, the ligaments. And the cool thing about it is we can treat all of that at the same time because you're able to look at the whole picture. And so I talk a lot about balance. There's a technique called balanced ligamentous tension, myofascial release, which sometimes people hear from other body work, cranial sacral.
Yep.
Exactly.
So I always like to tell people, because I was a massage therapist before,
Yes.
there's a big thing between massage therapists and cranial sacral practitioners and osteopaths and osteopathy in the cranial field. So, the very first osteopath that taught craniosacral to non-osteopaths was Upledger.
Yes.
And he created a whole institute that basically took an osteopathic skill and taught it in like a condensed form to body workers who are non-osteopaths. So you can see a craniosacral therapist, and they use some of the techniques that we use as well. In osteopathy, we kind of take that a little bit deeper and more specific, more individualized, whereas craniosacral is a little bit more like if this, then that. They kind of learn an algorithm.
Yeah.
Whereas we learn diagnosis, treatment, and our treatments flow a little differently,
yes,
I would say, than a traditional craniosacral therapist.
And I would say also every treatment is different. So there, I have, kind of like sit and I'll feel your back and things like that, but every treatment is different because every patient is different.
Even the same patient I treat differently.
Yeah, every time. Yep.
Yeah.
Yep.
So recently I added to my toolbox visceral manipulation. That's been one of the extra courses I've done this year, which is with the Barral Institute. Dr. Jean-Pierre Barral comes from France. He's actually a French-trained osteopath, and he has done a similar thing where he's trained non-osteopaths. So I've been in courses with physical therapists, which is always one of my favorite things.
Yeah, that's cool.
I did my dry needling training with physical therapists as well. So I'm kind of a little toolbox agnostic. I'll take any tool in my toolbox that I find is useful that I can use with my hands and with the musculoskeletal system to help align and balance and help somebody feel better. But my thing with osteopathy that I think is really unique is that we have these lineages. We have a very traditional lineage-based, who was my teacher, who was my teacher's teacher, who was their teacher's teacher. So in fact, this year at Convocation with our American Academy of Osteopathy, it was a little sad that my teacher's teachers are not there anymore. My teachers are there. Yeah. But my teachers' teachers are few and far between because that generation is being lost.
Yes.
So when we talk about our lineage, I'm from California. So my teacher, Dr. Rich Heiserot, was one of my big mentors. And his big mentor was Dr. Viola Fryman, who is a goddess in the world.
Renowned.
She is. And she was a British trained osteopath, but she was amazing. And I got to spend some time in my life with Dr. Fryman, and they are moments, I remember every moment I worked with her, every patient I saw with her, every glimpse I had of her at Convo, I remember because she was incredible and she's really a legend in our field. So my California training is very craniosacral, cranial osteopathic based, very myofascial based, very gentle, very subtle. I use a lot of indirect techniques that are soft and gentle. And I don't do a lot of the high velocity cracking and popping. But if you were an osteopath in Chicago, that might be a primary modality.
Yeah, based on who they were trained by.
Exactly.
Yeah.
What do you think your osteopathic lineage is?
I feel like I really lucked out because I had a good wide variety. So like one of my mentors, Dr. Heather Farrell, came from Maine or kind of the East Coast part. Dr. Ken Ramey came from Chicago. I forget where some of my other.
That walks.
Yeah, I was gonna say. And then so I had a really well-rounded from people from different areas, which I was blessed to have because it gives me more tools in my toolbox.
So tell me, from a patient perspective, if I was to come and see you in your new practice, which we'll talk about, what would it be like? What might I come in with?
Yeah, so people come in with everything from chronic back pain, which is really common, headaches, sometimes irritable bowel syndrome, chronic pelvic pain. We're in a car accident and have really bad whiplash or recovering from a different injury or surgery. So there's osteopathy can help with almost everything.
It's funny too, because I think when people think about osteopathic treatment and body work, they think about their musculoskeletal system, which we've talked a lot about today. But one of our biggest customers here are babies that are having a hard time with nursing, which you would not think that would be amenable because it seems out of that box, right? But babies that are having a hard time with breastfeeding, they do have musculoskeletal links to that.
Yep.
And we can work on the whole body, especially with babies. We got to work on one today. So cute, so little. It's really incredible. With the visceral manipulation, I've really been benefiting this year with diving a little deeper on my skill, working on the gastroesophageal junction where reflux comes from. So I can actually help get in there and indirectly kind of get to the tissues that connect to the tissues, like the arm bone's connected to the leg bone.
Everything's connected.
And I can get in there and I can actually get some space where the lower esophagus and the diaphragm and the stomach come together and give a little breathing room in there. You wouldn't think to see an osteopath for stomach acid.
Exactly. Yep.
But it can help.
And it helps it function better and and helps your body go back to like it self-helping things.
Which is exactly what makes us different. That is the fundamental difference. So this is what I say about being a traditional osteopath, whether I use manipulation or not. Is my philosophy is very much rooted in our traditional Andrew Taylor Still philosophy that the body is meant to heal itself. So I call Western medicine, which I use every day, all day. I very much got my Western medicine toolkit too. Find it, fix it, and make it go away. And that's fine. Sometimes you really want to find it, you really want to fix it, and you really want to make it go away. And we use that same concept with traditional osteopathy. I have a bad back. I want you to find the problem. I want you to fix it, and I don't want to be in pain.
Yes.
So that is a way that we can use our Western medical or osteopathic mindset.
Yeah.
But the true traditional osteopathic thinking is, how do I support the health? And why is the health manifesting this symptom? Why is the back pain here? Is it that you have degenerative discs or you have hurt yourself? Is it telling us something else?
Yeah.
What is the symptom? The symptom is a manifestation of the health. The health needs to be restored. So we can find things and get them out of the way, but the health is what heals, right? The health is what I like to call for other people, our prana, our chi, right?
Yeah, there's a lot of different
yoga and traditional Chinese medicine, right? We have this fundamental healing potential, right?
And it's like, you have to keep the, like, it's wiser than we are.
Yes.
It's way better at its job than we are. And so it's more of supporting something that works better.
Yeah, absolutely. And getting the other stuff out of the way. So we can use our skill set to get alignment issues out of the way, to get restrictions out of the way, to get problems like reflux settled down.
Yeah.
But at the end of the day, it's the inherent health being built. It's the inherent health that gets that vitality in the person that gets them out of our office, which is what we want.
Yeah.
We actually don't want you coming back all the time. We love you, but we're not like chiropractors where I want to see you 2 weeks, twice a week, and then once a month for the rest of your life, which is fine. The chiropractic profession, I'm not saying you guys are bad. You guys are great. You do lots of great work too. And there's really great body workers who are friends of mine in the city who do excellent work, but our models are different, right? We use our toolbox very differently because our goal at the end of the day as osteopaths is, that the health should take care of that.
Yeah. And ideally, if you need to see me again, it's once in a blue moon, or God forbid you got an injury or something like that.
I tell people usually I'm going to see them 4 times, and if I'm not getting anywhere with whatever we're working on, their back pain or the things that you mentioned they can come in for, then we need to look at something else.
Yes,
we're
on the wrong path.
Yep, we need to either do more diagnostics and do some imaging, get an MRI, send them to a specialist, or we need to use a different tool in our toolbox. That's when I'll sometimes bring in dry needling or a different manual, acupuncture. We can use a lot of different tools in our toolbox, but you should get somewhere in 3 to 4 visits.
Yeah. It should build on itself. Or I describe it a lot as like peeling an onion.
Yes.
So there's like different layers.
Which doesn't mean
as we go on in time, sometimes we get more and more layers.
Yeah, that doesn't mean that I don't love seeing an osteopath all the time if I can, because there's always something new. I'm a human being.
It feels good.
In a human body that is aging, unfortunately, through time. That's what they do. So it's not bad to have a doctor of osteopathy in your corner that you can then return to for quarterly maintenance treatments, once or twice a year, or if there's something new that comes up. Yep. So that's what traditional osteopathy is. I hope that we've educated folks on what it looks like to see one of us, and how would I find a traditional osteopath if I'm not here in Colorado. first, and then we'll talk about for the Coloradans, you're extra lucky because you can see both of us.
Yeah.
Yep.
There's a couple good ways. I would say there's the American Academy of Osteopathy, AAO, and they'll have a good list of osteopathic doctors who do use traditional osteopathy and hands-on medicine. There's also the Osteopathic Cranial Academy, OCA, that has a list like that too, especially for people who specifically use cranial sacral or osteopathy in the cranial field.
Yep. Yeah, and those websites you can use Find the Practitioner on their websites because their websites have information for us as practitioners.
Yeah.
But if you're a patient, you want to look on those websites under Find a Practitioner, and we'll link them in the comments. The other thing, a lot of people tell me, well, I looked at my insurance and I picked an osteopath, which is great. We have a lot of great osteopaths all over this country, and we do have a great training foundation, as we mentioned, but that doesn't necessarily mean that they practice traditional osteopathy. So it's always good to ask, because some people, as we mentioned, graduate really comfortable with that skill set and other people not as much. And some settings are not very supportive of that skill set. Even if your doctor is good at it, they just may not have time.
Yeah.
I know. Or they may not be reimbursed.
Yeah.
And so they might not do it. Which brings us to starting your own practice in Northern Colorado. Tell us all about it.
I opened last month in February. It was 3 years into a family medicine practice, and it got really corporate. And I wasn't able to see my patients for the time that I needed to help them, counsel them, not just prescribe them a medication, though medications can be helpful. And I got really burnt out. And I love OMT. It's super helpful. My patients, I think, who I did OMT for got better and felt better.
Yeah.
And I think that was the best route for me to give myself and my community the best treatments that I can get, because there's not that many of us who practice traditional osteopathy, and so I feel like that was really what I have.
Yeah, that's what you have to offer.
Yeah.
And it is shocking that it's hard to find us, even in communities like Fort Collins,
really is.
where you would think, oh, there's got to be multiple osteopaths in Fort Collins. And, you know, it's great to know that we can now find you at the Osteopathic Center of Northern Colorado.
Yeah, the Osteopathic Clinic.
Okay.
Colorado.
So close.
Yeah.
Well, we'll put your website in our comments.
Awesome.
Also, our clients and at Direct Osteopathic Primary Care can find you here starting in May, every other Friday, to expand our offerings.
Yeah,
which is wonderful.
Fun to work with you.
I know, it's
and
so
everyone
fun.
at your office.
Well, we
is
met a
lovely.
long time ago when you were a fellow and I was
Yeah.
teaching at Rocky Vista, so it's nice for the Bries to come back together. Well, we hope that this has been informative and that you can find a traditional osteopath near you and give it a go. Give it a try. Have a great day.